Hello, my name is Nathan Welchel, and this presentation was created for the Psych and Film assignment. In this case report, I analyze Anton Chigurh using DSM-5 TR criteria for antisocial personality disorder, empirical research on antisocial and psychopathic traits, and the cultural context of the film. This is the case report overview. The film is No Country for Old Men in 2007, and the character is Anton Chigurh. Character description. The role is he is a contract killer / antagonist. His personality is calm, controlled, rigid personal code, and highly goal-oriented. And limited history is shown and appears as an almost anonymous force of violence. Chigurh is introduced under arrest and immediately kills a deputy, signaling extreme danger. The film never provides a conventional backstory or developmental history, which is typical of stylized villains, but his consistent behavior pattern still allows us to infer a likely diagnosis. The film's setting and cultural context is early 1980s rural West Texas and the U.S.-Mexico border. The context is drug trade violence, economic uncertainty, and heavily armed culture. The values include rugged individualism, self-reliance, and suspicion of institutions, and mental health care, especially limited in rural and criminal justice settings. The environment normalizes a certain level of toughness and exposure to violence, but Chigurh's behaviors go far beyond cultural norms. The diagnosis is antisocial personality disorder. DSM-5-TR describes ASPD as a persistent pattern of disregard for and violation of the rights of others, beginning in childhood or early adolescence and continuing into adulthood. It includes acts such as repeated law-breaking, deceit, aggressiveness, and lack of remorse. Although the film does not show his childhood, his adult behavior strongly fits ASPD criteria: repeated murder, disregard for safety, and a lack of remorse. He also appears highly psychopathic, superficially calm, emotionally cold, and instrumental in his violence. Diagnosis and culture, if evaluated within the film's culture, likely conceptualized primarily as a violent criminal. Forensic evaluators would likely diagnose ASPD and high psychopathy. Cross-cultural perspective, antisocial traits appear in many cultures, but what is labeled disordered varies. Some collective cultures emphasize harmony and may diagnose based or disruption to group functioning, and stigma in U.S. culture, ASPD strongly associated with criminality and danger, and a widespread belief that people with ASPD are evil and criminals, essentially. In the film's setting, Chigurh would not realistically end up in outpatient therapy. He would be processed in the criminal justice system, and across cultures, people who chronically violate others' rights are often feared and stigmatized. Evidence, DSM-5 TR criteria. The selected of ASPD features relevant to Chigurh include failure to conform to lawful behavior, deceitfulness and manipulation, irritability and aggressiveness, reckless disregard for safety of self and others, and a lack of remorse. Because the film does not show his childhood or adolescence, we cannot formally confirm conduct disorder before age 15, but his pervasive adult pattern is strongly consistent with ASPD. And I highlight two especially clear symptoms: a lack of remorse and aggression, and also one criterion that is less clearly supported. Symptom 1, lack of remorse. DSM-5-TR feature indifference to or rationalizing having hurt or mistreated others. Specific examples from the film: the gas station coin toss scene, he pressures the clerk to call it for his life, showing no empathy; killing the deputy earlier in the film, strangles him with handcuffs, then calmly walks away; and Carla Jean's final scene, he insists she accept a coin flip. When she refuses, he likely kills her and carefully checks his boots afterward. Empirical support, people high in psychopathic traits tend to show no emotional response to others' suffering. And in each of these scenes, Chigurh displays no visible guilt, anxiety, or sadness about harming others, and he rationalizes his actions as fate or as part of a personal code, which fits the DSM description of a lack of remorse. Symptom 2, aggression and violation of rights. DSM-5 TR feature, repeated physical aggression and violation of others' rights. The film examples include strangles a deputy during an arrest and escapes custody, uses a captive bolt pistol to kill a motorist and others, often without provocation, and pursues Lewin Moss across the desert and into motels, killing multiple bystanders, and executes Carson Wells in a hotel room, then calmly answers the ringing phone. The empirical link ASPD and psychopathic traits are strongly associated with violent behavior and criminal recidivism. Chigurh repeatedly violates the most basic right, the right to life, often in situations where killing is not strictly necessary for self-defense. His pattern fits ASPD's emphasis on chronic aggression and law-breaking. Weak and absent symptom, the impulsivity and irresponsibility of ASPD. DSM-5 TR also lists impulsivity or failure to plan ahead, irresponsibility in work and financial obligations. In the film, evidence for these are weak. Chigurh is highly methodical, unscrewing air duct vents, tracking the money with a transponder. He plans diversions such as blowing up a car to steal medication from a pharmacy. We see almost nothing about his ordinary work history or finances. Impulsivity and irresponsibility are common in ASPD, but Chigurh is portrayed as carefully controlled and strategic. Because we lack information about his everyday responsibilities, this criterion is the weakest fit. A treatment plan for ASPD, proposed approach if Chigurh were treatable and in custody. Long-term cognitive behavioral therapy, or CBT, targeting distorted beliefs about harm and fate, victim empathy and perspective taking, and aggression control and problem solving, and structured forensic setting with careful risk management. ASPD is often considered hard to treat, but research suggests that structured skills-based programs can produce small improvements in behavior. CBT would focus on challenging his rigid, fatalistic justifications for violence and increasing awareness of others' suffering. However, realistic progress with someone as severely antisocial as Chigurh would likely be minimal. Ethical concerns and barriers to treatment. Ethical issues include therapist and staff safety in working with a highly violent client, limits of confidentiality if he threatens future harm, and risks that he might use psychological insight to manipulate others. Situational, cultural, and societal barriers. He is a contract killer and a fugitive and unlikely to seek voluntary therapy. Rural settings and prisons often have limited, overburdened mental health services and cultural stigma around both criminality and personality. Even if a treatment program were available, Chigurh shows no motivation for change, and ethically, clinicians must balance beneficence with non-maleficence and safety. In practice, he would almost certainly be managed through incarceration rather than treatment. Broader perspectives, the film portrayal. Is this portrayal accurate? The accuracy includes extreme lack of remorse, chronic aggression, violation of rights, severe ASPD with psychopathic traits, and the exaggerated portrayals include near invincible calm, lack of backstory, and stylized moral code, heighten his inhuman quality. The impact of film portrayals, this can increase public awareness that some people chronically violate norms, but often reinforce the stereotype that ASPD basically equals a serial killer or assassin, and it also may increase stigma and pessimism about treatability of ASPD. Overall, Chigurh is a somewhat realistic but highly stylized example of severe antisocial and psychopathic traits, and films like this can shape how viewers think about personality disorders, often by associating them primarily with extreme violence. And these are the references included that were used to make this presentation. Thank you for listening.